Okay, good. Good afternoon, good morning, good evening, wherever you are in the world. I'm delighted to be sharing this session of industry representation with my very good friend, John Boyd. Next slide, please. So obviously, this is our first of series of presentation that we tend to hold, to talk about the World Congress for Mental Health coming up in London in June, July this year. And I said earlier on, I'm Gabi Ivijaro. I'm the Secretary General for the World Federation for Mental Health. I'm also the President of the World Dignity Project, but I'm chairing this session in my capacity as the Joint Chair of the Congress Steering Committee. And the co-chair for this session is John Boyd, OBE, who is a former UK Member of Parliament, Health Minister, and MEP. And he's participating and chairing in his capacity as Joint Vice Chair of the Congress Steering Committee. He will also be representing the interests of London, and England in this excellent Congress that we are holding. Next slide, please. We're very lucky to have two excellent speakers also joining us for this industrial presentation. Sabine Barakola, who is the Joint Vice Chair of the Congress Committee. She is also representing the interests of the World Federation for Mental Health, during this presentation, and also Claire Brooks, another Joint Vice Chair of Steering Committee. She will be representing the interests of the World Dignity Project during this presentation. This Congress is in partnership between World Federation for Mental Health and the World Dignity Project. So this is why we're having these two strands, and we've been well supported by a very strong technical group, Phase 20. So they've got their representative, in this group, and they will also be presenting, telling you more about their expertise, So I'm hoping that we'll be able to, the next 1 hour, share some good ideas together. Next slide, please. So first of all, I want to say special thanks to the President of the Congress, Dr. Nasser Loza, the current President of the World Federation for Mental Health, who is in Cairo, sends his greetings, and he's representing the interests of the WFMH, and Sir David Goldberg from London, representing the interests of World Dignity Project. They both send their greetings and to all of you, and they want me to tell you, how they're excited that this Congress is taking place in London. Next slide, please. So why London? What is WFMH, and why is it important, for people to participate and for sponsors? First of all, London has a unique place in the history of mental health advocacy. This is where the WFMH was founded in 1948, in the same hall where we're having this meeting, the Westminster Hall. At the time, what were the issues? They were issues of the Second World War. There was suffering, all over the world. There were issues of poor care, for everybody. And what did they think at the time? They brought in experts, from all over the field, so psychiatrists, social workers, psychologists, family doctors, non-specialists, opinion leaders, and to come together to think about a new way of looking after mental health, to say that we citizens have a role. And really, so this is about that. It's about the citizenship, how we could have an influence at the United Nations and at the WHO, So we are now going to be having 75th anniversary, in next year. So this Congress is a part of the preparation for that. So advocacy is important. If you think about COVID-19, you can see how important mental health is. So we are nearly back to to where we started. So we want partnership. We want individual industry to support, to be part of it, because really many things have happened. Next slide, please. So we talked about 1948 and the crisis, and then of course we thought we'll have done a lot, but no, we have not done enough. We've done it. In 1948 was different, but there are new challenges facing the world. There are wars, pandemic, inequality, stigma, man-made disasters, natural disaster, technical changes, And really, so we have to think again. We need a new solution. And if you look at what former President of France said, in I think 2016, he said that the world is facing new changes, new dimensions, that we need different way of looking at issues, and that we need new paradigm. We need to come together, and that it's no longer just government, but it will be government, citizens, industry, researchers, and everybody needed to come together. So this is why we are inviting you to be part of the partnership. We need a new paradigm that the old will not work. Next slide, please. So, so this is a special invitation for the industry to come to join us. Well, because already we have colleges, who are participating, various institutions are participating. But now we want the industry also to play equal part and equal role. But I want to tell you something else, that, the Congress is popular already. Since we launched the website, over 98,000 people have already logged into the website, and many more. So really, so it will be an opportunity for you also to showcase the good things you do in partnership, with our technical group and all the people that we'll be working with. Next slide, please. So, I'll be telling you that, it's very popular. I really mean it, So, for example, so Her Royal Highness Princess Iman Sultan of Abdallah of Malaysia is one of the patrons. She sends her wishes and good invitation. She's looking forward to coming to London, in June. And she, and they're bringing a strong entourage from Malaysia to come to join us in London, really what she said, if you can read, if you go to our website, you will see her full message that London has a unique place, and that we need to use the power of London and this Congress to do more for citizens, for people, for policymakers. So really, so we have an opportunity, and she's looking forward to coming and, to talk about what she thinks the role of women and the role of policymakers in the world, and how we can move things forward. Next slide, please. Professor Nomos Sartorius is an eminent psychiatrist, used to be, in Geneva and well respected. And again, he said some things in his invitation letter to you all, that WFMH has a unique role and capacity to bring people together. Towards unique and capacity. So he wants, again, is inviting you to come to be part of what we're doing in London, So really, so many psychiatrists are going to be coming. We know that. Many policymakers are going to be coming. We know that, And so really, so we also, as I said, we want the industry to sponsor some of the symposia, that we're going to be having, to come to showcase the good work, because we also need science, as part of what we're doing. Next slide, please. So I told you already about Central West Hall. It's a unique place in WFMH history. It's a unique place in mental health advocacy, and will be unique for a very long time. So we have this excellent hall, that can cater for many people. They are used to running meetings, used to running congresses, So really, so they have a good floor plan that Phase 20 will show to you. So if you want to showcase your goods, it's a good place to come to do it. Next slide, please. This is a draft planner that we're hoping to use for this Congress. Of course, it may change, But one of the things you will see that we have special sessions for plenary, special sessions for symposia that people can sponsor. There'll be workshops, there'll be series of things, to be done, So really, there'll be an interaction. One of the things, I think we're a bit lucky also that in England, the rules have changed for people to be able to visit. And in Europe, the rule is going to be changing next week, So that we'll be expecting professionals all over the world, particularly in Europe, to come. So really, so you will have opportunity to interact with people. We'll have opportunity to share good ideas and kind of put these last 2 years has been terrible for behind our back and see how the future will look like. Next slide, please. So, so that's my brief introduction, and I want to hand over now to my good friend, John Boris, who, as I said, is very experienced in the field, He's done work in the WHO, he's done work at EU level. Actually, I was privileged to work with him on some issues about physical health many years ago. That was when I first met him. I was very impressed, I thought, how could a policymaker be so interested and know so much? And then I realized he was even be made an honorary member of the Royal College of Psychiatry. So really, he knows so much, And John, it's a pleasure for me to share this session with you. Over to you, John.
Well, thank you very much, Gabby. And let me say that there's never been a better time to advance the cause of mental health. COVID has speeded up science and regulatory procedures and brought a better understanding of comorbidities. Mental health figures in priority lists of policymakers. In the UK, as we celebrate our Queen's 70th years on the throne, her grandsons have been highlighting mental health as a tribute to their memory of their mother, Diana. And yet, if we don't seize this moment, as we've seen all too often in the past, public and political attention will move on. So carpe diem, seize the day we must. As we look around us, wherever we are in the world, we see mental health unmet need or inadequately met need. This despite the giant strides made by our scientists and practitioners. We've become more aware of the stresses and traumas lived with by our young people, by societal change and uncertainties among adults, and by the neuropsychiatric challenges that come with the benefits of longevity. In recent years, we've been commemorating the 70, 80, 100 years of the ends of global conflicts, and the voice of the families saying he or she never spoke about it. The charity Help for Heroes conducted a survey of British military veterans and showed them waiting 4 years before seeking professional help for their mental health problems. A quarter of them feared they would be treated differently by their friends, and a further quarter thought they would not be understood by civilian services. And that's why my personal drive has been the defeat of stigma. Just imagine that you've been to your GP and he's made a diagnosis, and you go around to the pub or back to work and say to your friends and colleagues, do you know what? I've just been told I've got schizophrenia or bipolar depression. Do they rally round, put an arm around you, buy you a drink, tell you their granny had it, reassure you that there are good treatments for it nowadays, and tell you to keep in touch and let them know how you get on? Or do they go silent, avert their gaze, remember they have a meeting to get to, slink away to phone home and tell their spouse not to let the children go to your home anymore? Or do you not go to the pub or to work or anywhere you might meet your former friends and colleagues because you're scared? Scared about your condition and scared about their reaction. Too often we go nowhere, we hide, we turn in on ourselves. We need to make compassion part of our lifestyle, part of our policy. And that's in its true sense, compassion meaning compatio, to suffer with you. Not just sympathy, but empathy, understanding and sharing the suffering. 450 million people in our world live with a neurological or mental disorder. 121 million of us live with depression, 3 in every 100 of us every year. 1 million people in our world commit suicide. 10 million try to. 1 in 3 of us go to our GP having mental health problems, but only 1 in 6 are diagnosed as such. And that doesn't mean that 2 in 3 of us will have good mental health. It means we may not be noticed, we may not seek, or we may not be offered treatment and care. It is an enormous challenge for all of us, but particularly for those daily in the front line, social workers, doctors, nurses, families, individuals, employers, and communities. So isn't it time that unique experience and skill that comes from living with a disorder and with the treatments and medications prescribed are recognized as being an indispensable contribution to the personal treatment plan and the planning of services? Often the physical condition comes first, as we've recognized in the WHO's work on diabetes and depression. In South Africa 20 years ago, I remember being told, we're very grateful for the support Europe gives us for HIV/AIDS, but don't you realize that hand in hand with HIV goes depression, and nobody wants to help us with that? The state of the world's economies means two irreconcilable truths. More people are going to have the burden of mental health problems, particularly depression, added to the burden of personal or national economic difficulties. And the cost of mental health treatments, drugs, services is on an upward spiral. We know that neuropsychiatric disorders are responsible for 1/3 of disabilities, 15% of inpatient costs, nearly a quarter of drugs cost, half the caseload of our social workers. In my country of 60 million people, some 90 million days lost at work each year. And 1 in 3 of us, of course, will be affected during our lives, if not more. The answer is not to say we have to cut back on services. It is to focus on more effective services. It is to realize that what we spend on better mental health and care for mental illness is an investment and not just a cost. If we don't invest, people's mental health will worsen and the financial burden to health and social care services and to individuals and families will become unsustainable. If we do invest, then people will recover or be able to manage their health, and then they will work and earn and pay taxes, which will enable better mental health services and more health challenges to be met. As we say, no wealth without health and no health without mental health. Good mental health is good for individuals, good for communities, good for companies, and good for countries. And while we're listening to patients, let us hear that cry I so often hear. It's the individual telling me that of course they would like to have a medical outcome from their treatment, but even more, they want quality of life outcomes. As one man said to me, I can live with my voices, I'm used to them, but what I really want is to be able to join in with local activities and not to feel excluded. So after 3 years as a health minister, 2 working in support of the WHO Global Campaign Nations for Mental Health, and then 10 as health spokesman in the European Parliament, I believe there are 3 key building blocks for a good mental health system: the adequacy of community services, the need to listen to service users and their carers, and the ability or willingness of different agencies to work together. And one more, an understanding from finance ministers that you need physically and mentally healthy people if you are to have a healthy economy. Thank you.
John, thank you very much, for that, for the clarity of the presentation, and of your experience, really we're very grateful. And I know, during the conference, you're going to say more things. So people, should definitely be queuing for your session, So thank you again, So I think that gives me great pleasure to introduce your next speaker. So I'm going to again be telling you why this Congress is very important. Is Professor Sabine Barakola. I've known Sabine for many years, and we've been in many forums and talking together. I know she's an activist, She runs even a special journal for social workers, really. So Sabine, thank you very much, and the floor is yours. Please introduce yourself properly.
So I hope that you can hear me and see me. So thank you for the possibility to present today about why should you come to London or why a company should support this Congress. Next slide. Because together we can win. Next slide. Mental ill health can have devastating effects on individuals, families, networks, companies, and communities, with 1 in every 2 people experiencing mental illness in their lifetime. Mental ill health also weighs heavily on societies and economies. The economic burden of mental ill health can rise up to 4% of GDP, and those with mental illness have poorer educational, employment, and physical health outcomes than those in good mental health. Next slide. Thank you. Like John said before, approximately 300 million people worldwide suffer from depression. More women than men suffer from depression. Approximately 275 million people worldwide suffer from anxiety disorders. About 62% are women. This means 170 million. 8% of employees have a mental health diagnosis. 14% of workers have a mental health problem. 5% of workers have mental health disorders, and 15% have so-called moderate mental health disorders. 53% of healthcare workers during the COVID-19 pandemic had symptoms of at least one mental health condition. Next slide, please. During the COVID-19 pandemic, many people's mental health worsened. The prevalence of depression and anxiety increased significantly. In Belgium, France, Italy, Mexico, New Zealand, United Kingdom, United States, the prevalence of anxiety in 2020 was double or more than double the level observed in previous years. In Australia, Belgium, Canada, France, Czech Republic, Mexico, Sweden, United Kingdom, and United States, again, the prevalence of depression in 2020 was also double or more than double that observed in previous years. Thank you. I would like to present a figure to you about prevalence of anxiety increased significantly in 2020. Like you can see here, it increased, this is the color for 22, in all presented countries. Thank you, next slide. And what about burnout at work? Almost half of all employees report being at least someone burned out. And like you can see, 49% of the respondents say they are feeling at least somewhat burned out. Thank you. And you and your company, you want to stand out from the competition and from other companies. Growth of an organization also occurs through healthy employees. You can present your products and your company in front of a very interested audience. You can perceive in London by experts responsibilities, famous networks, and you can meet them. For example, the leaders of the World Federation for Mental Health. We are the international membership organization to advance among all peoples and nations the prevention of mental and emotional disorders, the proper treatment and care of those with such disorders, and the promotion of mental health. We are committed to global mental health. The Congress in London is important for you and the World Federation for Mental Health. Next one. The 23rd World Congress of the World Federation for Mental Health, held in collaboration with the World Dignity Project, will reaffirm the founding principles and values of the World Federation for Mental Health and bring together experts with lived experience, carers and family members, mental health professionals from all fields, academics and policymakers. Next one. Present your company in London, support our work and the World Federation for Mental Health Congress in London. Thank you so much.
Sabine, Professor Sabine Kaula, thank you very much, for the presentation, really telling the world the value of this conference, again, inviting people to come to be partners, again, saying what we're thinking about for the future. So really, it's a very clear invitation, So, so thank you very, very, very much. So I'm going to hand over back to John Bowis, who will introduce the next speaker. John, over to you, please.
Yes, well, thank you, Sabine. And your last words neatly lead into my introduction of our next speaker, who is Claire Brooks, President of Model People, and she's going to tell us about the World Dignity Project and the partnership with World Federation of Mental Health. Claire.
Thank you, John. And good afternoon, everybody. And very honoured to be here and have the opportunity to tell everybody about the World Dignity Project. We were launched in 2015, a group of really patient advocates, healthcare professionals, and people concerned with citizenship who came together under the leadership of Professor Ibijaro, really recognizing that the importance of dignity in the world, but particularly to patients and healthcare professionals. And so our mission is fighting for mental health and well-being for all, with equality of treatment and dignity in patient experience as a basic human right. So recognizing the inequality in expenditure on mental health and recognizing the importance of dignity to patients. World Mental Health Day in 2015 the WFMH considered dignity to be so important that it adopted dignity as its theme. So that really kicked us off. And we undertake research, publishing, and advocacy activities to drive awareness and change in attitudes. And I myself am a consumer researcher, but I act as the Director of Research, volunteer Director of Research for the World Dignity Project. We're really bringing together practitioner and service user perspectives. So we're living at that nexus of practitioners and service users, much like the WFMH does. And that really underscores the partnership between WFMH and World Dignity Project on this conference. And we have wide support by professional and service user organizations, including the World Psychiatrists Association, WASP, and the WHO. Next slide, please. Here are our goals. We've got a tripod, if you like, three areas of interest. The public and service users, healthcare professionals, and policymakers. In terms of the public, we're looking to drive awareness of the importance of mental health and dignity. We're looking to particularly advocate for vulnerable patients and their caregivers and families by driving understanding of the need for dignity and addressing stigma. John talked about stigma. It is still an enormous issue worldwide, as he described. And so addressing dignity really means addressing respect, self-respect, and eliminating stigma. So we're very much involved with that discussion. In terms of professionals, stigma affects healthcare professionals as well, self-stigma. And so we have a role there, and primarily a role promoting the understanding of a dignity experience for service users. And through conferences like these, connecting professionals and sharing experiences. And through all of this, aiming to engage and influence policymakers. Next slide, please. Why does dignity matter? Well, it's hugely important. It's been demonstrated that worldwide, patient dignity is a critical measure of service quality. It's second only to access in terms of the way that patients feel about their experiences. It has a very strong correlation with patient ratings of patient experience ratings. And so companies who are concerned with patient experience really need to be concerned with understanding dignity because the correlations are very high and the driver is very high. It's also a critical measure of health service responsiveness. The WHO designates dignity as a key measure of health system responsiveness. That's the ability of health systems to meet patient experience expectations. So again, companies involved with understanding health systems really need to understand dignity. But dignity is a much wider idea. Dignity has international status in human rights policy. The UN states that dignity is inherent to all human beings and the foundation of freedom, justice, and peace around the world. This is a big idea indeed. It is a key idea in health system standards around the world. Many health systems require that patients are treated with dignity and respect. It is written into their policies. And it is, of course, a core element of healthcare professional ethics. Dignity also is a core domain of the major patient experience measurement tools around the world. So again, dignity really is important for those concerned with patient experience. And for healthcare professionals themselves, and for all of us, I think, dignity is one of those things that we think we know what it is. We think we understand it. It's been described as part of the collective unconscious. But do we really know what it is? Operationally, dignity is poorly understood from the patient perspective. These are leading academics from Warwick University saying that's not me. The measures of dignity are still very poorly understood, even despite its high correlation with patient experience ratings. We don't actually know what makes for dignity, comprehensively makes for dignity within patient experience. Next slide, please. So for a number of years, the World Dignity Project has been conducting research on mental health dignity to define what it is. We created very early on a taxonomy, which you can see here, which shows the three elements that we think comprise dignity. There's in the center that idea of universal dignity, that's equality of human rights, access to mental health care. And then there are two elements which really are about protection and about empowerment. On the left there, a duty of society and a duty of healthcare providers and caregivers to provide care, shelter, protection, and empathy. But also on the right there to empower patients, to give them the tools that they need for their journey to recovery, and hope, to give them hope. So a global first at the conference, we're going to share the latest results of co-creation research that we've been doing with service users and service providers. We've been developing a really comprehensive set of measures for dignity in mental health patient experience, those things that actually promote mental health dignity within health systems. And we'll be sharing this new information at the conference. Next slide, please. Next slide, please. So, sorry, the prior slide. So we hope to see you in London 2022. Other people have talked about mental health being even more of a global priority than ever post-pandemic. Our own research shows that the pandemic disproportionately affected those with a history of mental health treatment, and that remote therapeutic relationships affected patient dignity. So there's really more than ever a need to bring together professionals, service users, policymakers, and those in industry who are concerned with these issues to share experiences and agree on lessons learned. And we hope to see you there. Thank you.
Excellent. Thank you very much, Claire, for, again, walking us through the issue of dignity, and really, I know there's so much for you to share, and the dignity partnership to share. So we're looking forward to that in London, So thank you very much. So, I told you already that we have professionals speaking, we have people, researchers and but it won't work unless you have a strong technical backup, So we're lucky to have Phase 24. I've worked for many years from, I think, my first time when I still have my Afro hair in Granada to now I'm not bald, So really, so they will tell you now a bit more, Phase 20, over to you.
Thank you, Gabby. Hello, everyone. My name is Carmen Gil, and I'm part of the team of Phase 20, which will be the technical secretariat in charge of the execution of this Congress. Our company, Phase 20, has been operating in the event sector for more than 20 years. We actually have offices in Spain, Argentina, and in the UK. And we have a vast experience, not just organizing scientific or medical events, but also engaging with potential collaborators and sponsors and allowing them to take part of these kind of events in various ways. In London, where our office within the UK is located, we have already worked with different institutions. And now that the situation is getting back to normal after the pandemic situation, we're looking forward to go ahead with this project and get the most out of this venue, the Central Hall, which will be a fantastic structure for commercial exhibition and networking. Okay, in the past, the WFMH congresses have received attendees from all over the world as they have been hosted internationally. For example, as we can see in these graphs, last Congress that was held in Argentina in 2019 received people from almost all Latin American countries, Asia, different parts of Europe, and also Australia and New Zealand. When it comes to the attendees, they were in the majority clinical psychology specialists, followed by psychiatrists and then students. We can't forget other specialists that were interested in this area. For example, occupational therapists, social workers, general medicine physicians, and psychotherapists. We are all very excited about hosting this kind of event in London. London is one of the world's most visited cities, it's the capital of England, and is well worth the visit. It has a lot to offer, from magnificent history and culture to cutting-edge fashion and food. Our delegates could visit all the monuments and experience the diversity of the neighborhoods. They could visit Camden, they could spend a day in Portobello Road, and there are many opportunities for them to spend a few days in London. When it comes to sponsoring, through the different types of collaboration, your company will have the opportunity to get in touch with experts and leaders in the scientific field, as well as generate interesting work networks with both speakers and congressmen. It is a perfect opportunity to advertise messages of great visual impact. You will be able to display your products in the sponsor area, sponsor an activity, a scientific activity with the approval of the organizing a scientific committee, advertise your company and our products with several types of technological services, such as room access control, podium video walls, touch screen totems, or the interactive floor. You will also participate through other types of collaborations, such as sponsoring the coffee break, Congress bag, add documentation in the Congress bag, and etc. After this presentation, we'll send all of you a detailed dossier with more information about collaborations, like this summary, including prices. We also include further information about the cancellation policy related to the future agreement with potential collaborators and sponsors. You will also find a floor plan of the commercial exhibition area. The stand area is yet to be confirmed, but will probably be located on level 1 in the central hall, either in the library or in the lecture hall. And in this dossier, you can also find information regarding the registration policy, fees, dates, and the different country classification groups. We also include some information about accommodation. The official hotel will be the Novotel London Waterloo, and with this, in this dossier, we'll show you general information. If you need any further details, you just contact our secretariat. Well, that was everything inside. Thank you for your attention. And as I said before, if you have any questions, please email us at info@face20.co.uk, and we will be very happy to assist. I'll give the floor to Gabby.
Yeah, thank you very much, Kamel, for your presentation. And as I said, you know, you know what you're doing, and we're looking forward to welcoming you in London, you know. So, so this is the first presentation in this series. So if you have questions, let's take them. Any questions from anybody at all? So I know we're transmitting live, you know, so people can see, at least understand. And we plan to hold another one, you know, in an event very soon again, so that people can know a bit more and ask questions, you know. So, if there are no questions, I wait for Carmen. You are monitoring any questions?
There are some questions. Okay, Gabby.
Okay.
Well, are there going to be packages of virtual registrations for the industry to buy and promote among their people?
You lost me. I didn't hear well. Sorry.
Are there going to be packages of virtual registrations for the industry to buy and promote?
Yes, of course, yes, definitely. That's it. This is one of the things we're talking about. So we want industries to liaise with either yourself, you know, Claire or Sabine, you know, to see what they want, you know, because we want a flexible approach to supporting the Congress, you know, because we know things are changing. So that's really what we want, flexibility. So, you know, also one of the things that we've been talking about is also having regular bulletin during the Congress, like newspaper. So people want to sponsor that. So really, so yes, you know, so, you know, we're happy to discuss, you know, we don't want to be fixed about the plan, but we want something fluid and flexible. Claire, do you want to say anything about that?
I think fluid and flexible is the right way to describe it. I think hopefully people will talk to us about what's in their minds, and we can put packages together that meet those needs.
Sabine, any comment from you? You have to unmute.
I think you have said a lot of aspects, and I have nothing to add at that point. Thank you.
We intend to have a session, myself and John, and, you know, for policymakers, you know, because Her Excellency, the Princess from Malaysia, also wants to have a session. So people may want to sponsor that, but it will be a small working group, you know, only by invitation, you know, because really, you know, we also want, so that will happen. So again, you know, so if you want to know a bit more about that, if you speak to Carmel, and then Carmel will speak to John and myself later.
Gabby, I also want to mention the mental health champions, because we're intending to, this is a program that the World Dignity Project runs, which recognizes the work of patient advocates and peer advocates in the world. And we award mental health champion status to these people. So we will be having an event for them at the conference, and anybody who wants to really engage with peers or with patient advocates, that would be a good sponsorship opportunity.
Thank you. Cameron, any more questions?
They're asking, who will be the plenary speakers expected to attend?
So we're very lucky to have excellent plenary speakers across the spectrum. So that's one of the beauty of this, you know. Most of the president of all the colleges have accepted to come, you know, as plenary speakers, you know, so we'll be updating it as we go along the next bulletin. You know, we have excellent speakers from Switzerland, Germany, you know, that have agreed to be. We have policy makers who want to give plenary speakers. In addition, we also want people with lived experience to speak, you know. So really, because, you know, we say it's a partnership of, you know, if you think about formation of WFMH, you know, it's a partnership of citizens, you know, so they're really good, you know. One of the leading psychiatrists in France, you know, Priya Thomas is coming to speak, you know, and, you know, Nomo Sartorius is a plenary speaker, you know, so John, you've heard of him already, is a plenary speaker. No, so really, so we're very lucky with that, you know, I think, you know, so, but in addition to plenary speaker, we want citizens to present papers, original thinking, you know, so, so those are the kind of things we want. We're hoping that every 2 weekly, we should be having something about a plenary speaker or a speaker as we go along in our regular bulletin. So that will happen. So this is, you know, and you can actually volunteer to sponsor a plenary speaker if you wish, you know, so that's also possible. Maybe Sabine can speak about one of the plenary speakers we're expecting from, is it Germany or Switzerland? Sabine, over to you. Microphone on, please.
Gabby, I'm not sure.
I say one of these plenary speakers that you've just approved, you know, from Germany. You want to say anything about him, or we waiting on that time?
I have the feeling perhaps it needs a little bit more time to have a few conversations about that. But we have invited this, I can say, very, very experienced colleagues, and I think very, very interesting colleagues for the Congress. I'm so honored. But perhaps at the next meeting, industry meeting, at the same time. Thank you.
Thank you. All right, thank you. Yes, next question, please, Carmen.
How to submit a symposium, not only an abstract?
So you can submit, obviously you can log now to the website to submit, but I had an email yesterday from somebody from Switzerland said it had it difficult to submit a symposium planning. So I will look into that with the technical group later today. So because, so I'm not sure why, whether it was his problem with his site, but again, so if you're having difficulty, you can send your symposium plan by email to us directly, and we will help you to upload it. So you don't need to, if you struggle, let us know. You can send it to Carmen and CC to me or to myself or to any of the vice chairs, who will ensure its process. So don't allow technical issues to make you flustered. Send an email and we'll process it. As I said again, it's about flexibility. You go to the website, if you're struggling, send an email. Cameron, any more questions?
Yes, I think I have one more. Give me just a second. Okay, how can I get the dossier with the collaboration options?
So again, send an email to Space 20. They will be able to, if you send an email to any of the vice president today, they will direct you to the appropriate place. It's about that flexibility. The world's been terrible, too many rules. Now we have to be flexible and more adaptive. So write to us, send an email. Any of the planning member today, we make sure we get it done. And again, in the series of bulletins, we will advertise it. So don't wait. Don't let system, be the issue. Send your email, and we will respond. John, do you want to say anything?
The only thing I would say is that whatever is planned, it will be flexible because life moves on.
Yes.
Goodness knows what's coming out of today's news from Ukraine.
Yes.
But there will certainly be mental health implications from that, just as there have been from the criminals who put people in unsafe boats and put them into the sea, whether it's the Mediterranean or the Channel here, and all of those have a mental health implication. And my hope is always that our people and our policymakers will look and see not how they can stop people coming to another country, but how they can help, and how we can help in not resolving the problems between Russia and Ukraine, but at least looking out for the people and the movements of people, which will no doubt follow. So it's just a message that just because we haven't mentioned it today doesn't mean to say by June we may not have a wider agenda than perhaps. So if anybody has ideas on that they become aware of and think this should be covered, that would be a good message to us from them.
Thank you very, very much. Claire, anything you want to say, so far?
Just that really reflecting what John and Sabine have said, we're at a unique point in human history, if you like, almost, that, there's much more awareness of the fragility of mental health at the moment. And so I think London's a very good opportunity to gather and really discuss lessons learned and what we need to do going forward. And I hope that, a wide body of sponsors will really be part of that discussion and part of framing the next steps, things we need to do.
Thank you. Sabine, anything else from you? Any reflection? Microphone, please.
I would like to repeat my last sentence of my presentation. So please support our work and please support our Congress. in London. Thank you so much.
Thank you. So, Carmen, any more questions?
There are a few comments saying excellent information and thank you. And there is one more comment that I will send all of you, okay, for you to review.
Okay.
About
so I know
petitions for.
I know we said 45 minutes to 1 hour, so we spend about 50 minutes, so we have 10 minutes. If we have no more questions, we can end early, but we need to plan another because, we're reaching to many people in England, who have been interested. We will have to dedicate a special session for them within the 2 weeks. They want to know a bit more, so they want to know what are the social activities happening, I don't know enough yet, I think, the laws have changed, so it's making life easier. I think it's from today, you don't have to wear face masks in public places, but we still need to be careful. So I think I will give room for my joint chair, John, to give the last word, and then after that to phase 20, and then we can round up.
Well, thank you, Gabby. I think my last word is actually perhaps an additional word, which is something that I've always been interested in, and that's the whole question of mental health at work. I think we undervalue that as a policy too much. And it's just to say to companies, employers, organizations that may be listening, not only do we want your input in terms of support for this conference, but we want your experience. And if you have some good experience of what you've been able to do to improve the mental health of your workforce, why not bring that to the conference as well and let us hear about it? Because a lot of stigma actually comes from people at work unable to or frightened to reveal the problems they're having in case that affects their employment, their promotion, and so forth. And good employers will always find ways around that in a non-threatening way. So it's just, there are many aspects to mental health that we would welcome, but we hope that you who are listening and watching will bring forward your support, but also your ideas.
Thank you, John. So, Carmen, anything from you, phase 20, you want to say before we round up?
Simply that we are here for anything that that you need, that our audience needs. If you contact us, I will be happy to send the dossier or discuss any collaboration options. Okay.
Okay, so this is left for me to say thank you to the panel, first of all, to Sabine, Claire, and John for excellent work. Of course, Cameron, I've known you for a long time, so thank you. To phase 20, and all the other technical people behind, because we are the face, but a lot of things happen behind, so there's a technical team, both in WFMH, phase 20, and World Dignity Project who are doing things. So I want to say I'm very, very, very grateful, and I look forward to the next presentation, and I look forward to this collaboration. Together, we can make a difference. And I think that's where I like to start with. Together, we can make a difference, and let's come together to make a difference. So I'm going to say thank you very much. Goodbye. I wish I could speak multiple languages, but I can't, just a few ones. And the language I speak, Yoruba, most of you may not understand. So I'll say bye-bye to all of you. Thank you. Ciao.
Bye.
Bye.